Case Scenarios on Beneficence, presented by Dr. Kalyan Varma, Professor, Forensic Medicine and Toxicology. Objective: to help medical students understand the principle of beneficence through various real-life scenarios, highlighting the importance of acting in the best interest of patients by providing benefits and balancing these against risks and costs. Scenario 1. Preventive care. Situation: Dr. Mehta notices that many of his elderly patients are not receiving annual flu vaccinations. He decides to organize a free vaccination drive at the local community center to ensure his patients and other community members are protected against the flu. Discussion promoting well-being. Dr. Mehta's initiative demonstrates beneficence by proactively protecting the health of his patients and the community. Preventive measures. Ensuring access to preventive care can significantly reduce the risk of illness and complications, thereby benefiting public health. Community engagement. Engaging the community in health initiatives helps to promote widespread health benefits and prevent outbreaks. Scenario 2. Pain management. Situation: Mrs. Roy, a 60-year-old woman with terminal cancer, experiences severe pain that affects her quality of life. Her doctor prescribes strong pain medication, even though it might hasten her death due to its side effects. Discussion: balancing benefits and risks. The doctor's primary goal is to relieve Mrs. Roy's suffering, demonstrating beneficence by prioritizing her comfort and quality of life. Palliative care. Providing effective pain management is a crucial aspect of palliative care, focusing on the patient's well-being and dignity. Ethical considerations. The potential risks are weighed against the significant benefit of pain relief, reflecting a compassionate approach to patient care. Scenario 3. Early intervention. Situation: a 45-year-old man, Mr. Gupta, is diagnosed with prediabetes during a routine checkup. Dr. Patel advises lifestyle modifications and prescribes medication to prevent the progression to diabetes. Discussion: preventing harm. Dr. Patel's actions are guided by beneficence, aiming to prevent the onset of diabetes and associated complications. Long-term benefits. Early intervention can significantly improve Mr. Gupta's long-term health outcomes, reducing the risk of severe health issues. Patient education. Educating Mr. Gupta on lifestyle changes and medication adherence is essential for achieving the desired health benefits. Scenario 4. Emergency treatment. Situation: a 30-year-old woman, Ms. Sharma, is brought to the emergency room with a severe allergic reaction. She is unconscious and unable to provide consent. The medical team administers life-saving treatment immediately. Discussion: acting in the patient's best interest. The medical team's prompt action exemplifies beneficence, as they prioritize Ms. Sharma's immediate need for treatment to save her life. Implied consent. In emergency situations, it is assumed that the patient would consent to life-saving measures, aligning with the principle of beneficence. Urgency and care. Providing timely and appropriate care in emergencies is a fundamental aspect of medical practice aimed at benefiting the patient. Scenario 5. Chronic disease management. Situation: Mr. Khan, a 50-year-old man with chronic hypertension, often forgets to take his medication. Dr. Rao sets up a reminder system and schedules regular follow-ups to ensure Mr. Khan adheres to his treatment plan. Discussion: ongoing support. Dr. Rao's efforts to improve Mr. Khan's medication adherence demonstrate beneficence by actively working to manage his chronic condition and prevent complications. Patient engagement. Involving the patient in their care plan and providing tools to support adherence can lead to better health outcomes. Holistic approach. Addressing barriers to treatment adherence is part of a holistic approach to patient care, aiming to maximize benefits and improve quality of life. These case scenarios illustrate the application of the principle of beneficence in various contexts, emphasizing the importance of acting in the best interest of patients. By understanding and applying beneficence, medical students can ensure they provide ethical and compassionate care, promoting the well-being of their patients. Thank you for engaging in this discussion on beneficence.